Hi everyone, my name is Yi. I'm your host for Occupational Medicine Pearls podcast. In today's episode, I would like to describe about proportionality in occupational medicine. Proportionality refers to the principle that any actions, investigation, restriction, or any deferral imposed during fitness for work assessment should be commensurate with the actual risk posed to the worker, co-workers, or the public. It is a key important clue, if you can say, when we are performing any fitness for work assessment or any pre-employment work. The core principles are that when we are doing intervention, our interventions must be proportionate to the identified risk. This means that the clinical finding must be relevant to the job demand, and if we are doing investigation or restriction, it must be the minimum necessary to quantify or manage that risk. And also, the decision must not impose unnecessary burden on the applicant or the worker. Usually fix and glue together a lot of the important concepts in our work. Things like clinical medicine, ethics, and law, they're important. Why proportionality? Why is it important? So when we make decision, we have to think about how does it impact people. So we have our decision have impact on individual, and if we make disproportionate fitness decision, it can cause loss of income, psychological harm, erosion of trust, and unnecessary medicalization. So this could happen if we are setting extremely cautious or extreme risk avoidant behavior with investigation, decision-making fitness, that sort of thing. And what about impact on the employer? Well, they lose key or important employees, so there is operational disruption and also unnecessary deferrals, delay recruitment, and workforce planning. And also, if there is unjustified restriction, and there will be risk of argument about discrimination and also reputation risk. Excessive gatekeeping at the start may reduce the employment number, and also many businesses may not use your service. What about public safety? If we are under-cautious, for example, if we allow someone with uncontrolled diabetes or sleep apnea to be driving public transport or high-risk vehicle, that can be very important. Critical incidents could happen. Or if we are overcautious and we are restricting healthy workers unnecessarily, and that may reduce available workforce and set unreasonable precedents. When we are thinking about proportionality, it has to make sense from within the legal and ethical framework. From the law, we are thinking about Work Health and Safety Act, Disability Discrimination Act, and Privacy Act. So these are important. From the ethics, our core values of beneficence and non-maleficence are important, and we rely on individuals' autonomy to have a right to work and to make informed decisions about their health. If we put unnecessary restriction, that would restrict their autonomy. Justice is important as well, so it has to be fair and balanced. From how we are doing decision making, so we can think about step-by-step approach, and you could be anyone you are seeing, and you may be making these decisions consciously or unconsciously. The first thing is that we may find a condition or an issue that could be like hematuria, asymptomatic, or proteinuria, or blood pressure of 158/89 in one measurement reading. So what is the clinical abnormality or concern? So that's important. And then step 2 is that whether this is relevant to the role, and we can make that decision. That can be based on individual and the role, and that include generally physical demands, psychological demands, cognitive and sensory demands. Is it a safety critical job? What is the work environment? Are they going to be a situation driver, or are they going to be flying a jet planes? And what does the regulation tells us? Is it like CASA for the airplanes or the Off-Road standard for driving? Now we identify the problem and we identify if it is relevant to the role. And the third is we have to quantify them. And can we identify or can we quantify the risk with available information right now? And then we can make decision. If it is not, we have to defer it, and we have to decide on what do we need, and we have to do minimum intervention required. and that has to be appropriate to the action that we are thinking. Afterwards, we have to communicate that decision transparently to the employer as well as the potential employee as well. And it is important to keep the privacy principles in check when we are communicating to the employers. The next step I want to include is that after we see someone for the assessment, we may have to send people to do further testing. We can call deferral. So you're not making the decision right now. And the second step is that you regard this person as some degree of risk, but they are fit to do the role. However, you have duty of care to inform the worker and their healthcare provider about that abnormal finding. How do you tell which one to use and when? So that's always a tricky bit. So duty of care letters are important when the findings is relevant to individuals' long-term health, but not to the immediate work safety, and the findings doesn't meet a conditional standard or regulatory threshold, and the overall clinical picture is otherwise reassuring, and the role is not safety critical in a way that amplifies the risk. For example, you found a very good example would be you found a mole on the shoulder during shoulder examination, and that is not relevant to their work as a mining operator or machine operator, but this could be cancerous, so you refer them to their GP for checkup for safety care. Or you may find a murmur and the role they're applying is an accountant in the urban setting, and that could not have significant impact on how they do the job. In that instance, you can refer it as a duty of care letter. It is a professional obligation. It is important to write properly, not just telling the GP what to do. And what about deferral? So deferral is when there is a finding is potentially relevant to safety critical work and the risk cannot be quantified with available information alone. And if the worker is sent to remote or heights, or if it is diving, and they may be fine in the current in the city or in the medical center setting, but in the places with restricted or very limited healthcare facility, the risk become problem. Or the third is that we don't know. There is specific information gap, and if we know the information, that might be able to solve. Things we need to avoid is that deferring for incidental findings with no safety relevance. So common thing would be you found isolated high readings of blood pressure, and you sent a letter to the GP to get rechecked, and before you make a decision for a role that has no relevance to having high blood pressure, and you just want to be safe before you make decision, and that is not appropriate. And also you are requiring investigation that are well within potentially normal variation, like finding very few ectopic peaks on the ECG and applying urban office worker standard to every role regardless of the context. And when we are writing question and without asking specific question to the referring to the specialist. So these are important things that we need to be aware of. And finally, the last step is that communication and patient or the worker experience. And when we make these decisions, sometimes you may do that within a flash, within a few seconds. Sometimes this can take hours, something you have to go back and think about. Nonetheless, we need to explain the reasoning. If you are telling a train driver that they are not fit to drive, and you need to explain why you want them not to drive why you regard them not fit to do safety critical role. And that's important, that's fair, and that's justice, and they have the right to know you are making an important decision not just for your health, their financial well-being, and people who are relying on them. And we need to be specific about what is the next step. And you can say that I want you to have sleep assessment, or I want you to see a sleep physician to assess obstructive sleep apnea, and I want you to go and see in this particular clinic and do that, and I want them to write a report. So we need to provide a specific instruction. Remember that many workers, they are not in our healthcare setting. They are not dealing with these problems every day. So they might be the only time they need to go and see a specialist. So please do not expect them that they will know the procedures. And that might be, 1,001st time or 1,001 time you are doing that this week, but it may be for the first time for them. And we need to acknowledge the impact of our decisions and need to know that people will be frustrated, angry, and they will be venting their emotions to you, and you need to understand that we're all human. We could all well be in the same situation. And we have to also tell them that I want you to do A, B, and C step within a specific time frame. And if you can do that, how quickly you can make these decisions, these are important. Can you make the decision within 5 days if they can provide with a report or something? All right, that's all I have for proportionality. This is not really an exam topic, but an important concept to understand when we are working, and this sort of things stay behind and help with the decision making. But if you get the concept behind, that helps with the work. All right, have a good day.